Everyone settled in here? Okay, 9 o'clock. Chris, you go right ahead.
Okay, so the first item we have is a healthcare update from Oswald. I believe we have Janet online.
She up at the top there,
Um,
up in the top right corner.
I'll
Click on the two.
Chris, do you have minutes?
Oh,
Thank you.
there.
Is it that high or is it?
Okay.
And click on the three dots. Let participate.
Party. It's a fashion party.
Which is it?
Yeah, that's just
Don't mute all. No.
Can you guys hear me? Good morning.
Janet. Hi, Janet. We can hear you.
Hi,
Thank
Janet.
you. Can you hear
Great.
us?
Can you also let in Dan Sabo? He's filling in for MedHat.
Let's see if
If
we
he's
can.
connected, just do the same thing around.
Okay.
Yeah, that's why I raised my hand. You can,
Sorry, Janet. We're having a little bit of.
that's okay. Yeah, we both were like, it said viewer only. And so he kept messaging me going, I can't get in. I'm like, I can't
Yeah.
either. And then I didn't know how to message you. So thank you.
Well, group today we have Janet and Dan. They are both from the Oswald Company. Janet is the Vice President, Senior Client Executive. This is all in reference to Healthcare Consortium and some plan changes that we did. So Janet today I believe, is going to give us a brief explanation as to why the consortium decided that doing some plan changes was necessary. And then she'll go over, I believe, what this might mean for the Palisades School District. When she's done, as she's at a conference too, so we don't want to take too much of her time. I know she's doing this as a favor. So after that, Dennis and I can cover some of the resources that we have in place or are going to have in place for open enrollment this year.
So good morning, everyone. Thank you so much. And I'm sorry. Yeah, I am at a conference. Actually, I'm sitting in a hotel room. So for the moment, hi. So I don't know if you want to see this ugly background, but good morning, everyone. So today, really what we want to be able to do is, talk a little bit about, where we're at. And, Palisades participates in this healthcare consortium with 11 other school districts in the Bucks and Montgomery counties. And, as that, you're getting a lot of value because you're getting group purchasing, right? Rather than purchasing on your own, you're getting group purchasing power by allowing you to be a much bigger number by being in with the other districts. But the problem is, as we all know, healthcare is not changing as far as it's continuing to go up. So, as when the consortium started, one of the things that they did is when they looked at the benefit plans, they offered four different medical plan options. During that time, they set those plan designs up to have specific actuarial values. And what an actuarial value means is it's really looking at what is the value of that benefit plan. Okay, so how much of the coverage is being met. So for example, a 95% actuarial value means that the plan is paying 95% of benefits. So there's 5% that works out to some type of cost share, I guess. And Dan, you can help me if I'm not explaining that correctly. But we looked at each plan, or the plans were looked at, and this was before Oswald was the consultant, that these were established. During that time that the four plans were established, there was roughly about anywhere between a 5 to a 10% differential in those actuarial values. Well, over time, because we haven't really adjusted any of those, we haven't made any plan changes, we haven't done anything, all of those plans have come so close together in an actuarial value that even from a contribution standpoint, You know, when you set the employee contributions as your own entity that participates, because those actuarial values are too close, the contributions also don't make sense. So what we really did is we re-looked at all of this and said, you know, what do we need to do in order to, you know, again, long term, we want to make sure that there's sustainability and that the consortium can continue to offer competitive plan design offerings at a fair price, right? And setting those contribution values that make sense based upon the plan designs. So I said a lot there. I'm going to pause for a minute to see if there's any questions or if that makes sense to everybody.
Questions?
Well, I'll just restate what I think I've heard. So when these 4 plans were established, what did you believe was like the difference between the costs to them? Was it 10%?
So it ranged anywhere from, so that the highest value plan was a 95% value. And then it went down to 80, I want to say it was a roughly around 85. It might've been 86, somewhere in there.
Okay.
When the plans were first established. But now there is less than 1% between the first for 3 of the options. And roughly right now, total between all 4 plans, there's less than a 5% differential between all 4 plans. So the plan that was at an 85% is all the way up to a 90% now.
Okay. Okay. Thank you.
Of course. Any other questions? Okay. And I know, I don't know who's controlling. Jessica Eyrig is also one of our team members. I don't know if she's trying to get in. Sorry, she sent me a chat and I was trying to pay attention to the screen and talking to you, but I don't know if anybody.
We were watching for her, Janet, so we'll look for her again.
Okay, thank you. So again, so that's one part of the reason why we're making the change, right? The other thing that we found, believe it or not, is when we looked overall at how people were using the coverage, that because of some of the values of the plan, people essentially are overinsured, meaning while we want to be able to give them choices, and that's still very important. So we're still going to continue to offer more than one plan. The problem is that people are buying things and saying, oh, well, I need the plan that has the 0 deductible. But ultimately, when we looked at overall utilization, people, you know, because your preventive services are 100%, you know, they were overinsured. So they're basically buying this much richer plan and they don't really need it because they're not using it. Does that make sense? Mm-hmm. Okay. And then when we,
if you wouldn't mind, a quick question with that. So, some people are probably believing that it's better to have and not need. And also in regards to that, is there a premium with these plans that offer 0 deductibles?
Well, there is, but again, going back to the point that all of these actuarial values of the 4 options started coming closer together. You know, if you're as an entity, I want to say, and Deanna, keep me honest here, 21%, I think 6 in my head, I feel is like maybe your highest contribution, or maybe it's 17. I don't know. We work with 12, so I might just be having that mixed up. So even the 17% contribution is probably not enough based upon the value of the benefit. So we just, you know, in order to help everybody sustain, we looked at it and ultimately 29% of the population of all the entities that are covered under the consortium had less than $500 worth of claims, okay, in a 12-month period. So they're buying something that's a much richer benefit when ultimately, you know, they don't need it. They probably, and then 40% had claims that were less than $1,000. So what we're trying to do is just realign to make sure that we're still offering, again, competitive plans, at affordable prices, things that make sense. So again, to create long-term sustainability for everyone that's covered.
Did that clarify? Did that answer the question? Or do you want to clarify your question a little bit? Because I think I know where you're going.
Well, so go ahead. Where am I going with this?
You're trying, so the idea of, is there a plan still without a deductible? Is that what I heard there?
No, what I'm saying is you and I are two different people. We'll
Correct.
choose what we think is best for us.
Correct.
And if I want to pay a premium above that, because that's the comfort level I want to be at,
Yeah.
so be it. Just like the policy I have now with my family, I will pay the premium so I have the coverage. I want to have it just in case I need it.
So the current plans that we have for this year, the richest plan, OC1, that's where we have a 21% contribution rate for the professional staff.
Right.
And then it varies as the plan, actuarial value goes down. So the percentage that we pay as an employee will go down if we choose a less rich plan.
Understood, but we're, if I understand correctly, we're at a point now where we have 11 other school districts. We're grouped together. All right, we have 4 different medical plan options with a 5% difference, but we have certain individuals based on the numbers that we just heard now, percentages that are not using the plan, but that's what they're choosing, and it's costing all districts because of that. Am I understanding correctly?
It does.
Okay.
Yeah, it will.
And so I'm just throwing this out there. So if individuals want to have that premium plus plan, we'll put an extra sticker on it. And the school district shouldn't pay for that. It should be the individual itself. That's just my thinking outside the box. If the policy that I have, and I'll use myself as an example, the policy that I have is a group policy per se, but I want extra things added to it. I pay out of pocket for that. Is that an option as well? No. Okay.
Yeah.
So I'll just say that I agree with, with you. I'm waiting for the punchline. So that's why I was keeping my comments,
Right.
at bay, but I just wanted to offer support that I agree. What my initial concern is, but once again, I'm trying to hold back, but I felt the need to comment. My initial concern is I don't want to take away something that is currently an option just because we think it's better. You know what I mean? But I understand there's a fiscal responsibility that needs to come into this and keep everything viable. So I'm just hoping that at the punchline, I'm going to feel confident that our staff isn't going to feel like things we're taking away from them and that it's a big negative. So
Yeah, understood. Well, and I will tell you that when we made the changes, that all the trustees had an opportunity. I mean, we've held several meetings to go through these additional options and create plans that everybody feels are still good plans to offer, but get us back into those initial actuarial values. Because again, remember, and some of your board members, I mean, you work for other non-public entities, or you work for other, places that, when you see some of this, you're saying, okay, well, as taxpayers, or we need to figure out a way to keep costs down. And so ultimately, we've created plans that still have those preset actuarial values. So getting us back to that 95 for the most rich plan. So to your point, if people want that plan, they're going to pay more for that, right? But then creating plans that are lower options. I mean, think about it as school districts, you start hiring younger folks. They don't necessarily need, they're looking to save money in their paycheck, right? So they may not want a first dollar plan. Or they may have worked somewhere else and realized that having a high deductible plan or a higher deductible is okay. Because if I'm only going to the doctor a couple times a year to get my preventative checks, those are all covered at 100%. So why would I want a plan that I'm paying a lot of money for if I'm overall healthy? Okay. And Dan, I don't know, I feel like you maybe put your hand up before, maybe you were trying to say something. So I'm going to pause there for a second.
Oh,
Dan
no, all
is
good.
Dan is one of our financial analysts. So Medhat, who works on your account on a day-to-day, couldn't unfortunately be here today, but Dan does the same things that Medhat does. So Medhat and him talked and brought him up to speed. So Dan, go ahead.
Oh yeah, no, I was just I think I had some connection issues, so I did have to rejoin. I think that's what you were looking at, but I think just
Oh, okay.
in general, I think you know, your explanation was correct, that for the longevity of the plan and for also for different options, you know, these options aren't you know, drastic changes in any way. I think that, you know, seeing you know, some savings where people are paying, you know, $200 a month maybe doesn't make sense for them if they could, you know, pay you know, 150 a month and save that money instead by moving to a slightly less rich benefit. So that's what we're going to outline here today.
So Janet, real quick, just
Yeah.
the tool that we're talking about for employees to check and see which plan is good for them. We haven't had that in the past, and they will have that opportunity to go through and find out which plan suits them the best, which is something new and will be helpful for people. That hasn't happened before. And this is something that the consortium is going to do with these plan changes, so that people have an idea on, hey, if I have a lot of visits to a doctor, this is the best plan for me. If I don't have, might be the best plan. I don't know if you want to speak any more about that.
Yeah, so what we're putting in place is what we call a decision-making tool that is basically you know, it's a web-based application where it talks members through, like, you know, again, none of us can predict what our healthcare costs are. You know, we don't know if something catastrophic is going to happen, but we do know that if any one of us that are covered, whether it's myself or if I have a family, and let's say maybe I'm a diabetic, so I know that I go to the doctor so many times a year, or I know what my prescription spend, like I know those anticipated costs. And then maybe I also know that I have 2 kids, and unfortunately, maybe I visit the ER a couple times a year to take my children. So you can cost estimate those things out by answering some questions. So the tool is a very simple tool that basically handholds the member through a series of different questions. If they answer all those questions, then what it does is it has all the information of the plans built into the program. So then it'll say to the member, in addition to your contributions, it'll say to your member, here's what your costs are, and this is the best plan for you. Of the options that are being provided to you, this plan probably makes the most sense. Now, again, a member doesn't have to use that, or they can say, oh, I don't know, I still don't feel comfortable with that. Because maybe it's going to select the plan that has, you know, the higher deductible, or maybe the lower premium, and then they're like nervous because they look at it and say, well, I'm still concerned. It just is a tool to help guide them through that process.
So also, Janet, the plan design changes are also meant to make people better consumers of healthcare. If you have this very rich plan, you're going to use it no matter what. You're just going to use it all the time because you have it. You have that ability, and you may get things that you don't necessarily need or aren't recommended by a doctor just because you have that opportunity. By changing these plans, it's making people look at costs and make better decisions about their health care that aren't necessarily, not necessarily based on finances, but based on, you know, being smarter about what you're going to do with your health care. Instead of going to an MRI facility that costs $3,000, you may look and find another one that costs $1,000. So those we want to create better consumers of healthcare, which will save not only the individual money, but will also save the district.
I think, I mean, that's awesome. And this tool that you're talking about sounds, you know, phenomenal. Something I wish that we had. I guess I'm always going to play the devil's advocate a little bit, because somebody might say, well, this is a smarter medical pathway for you to do something. Well, maybe I don't feel that same way. Okay. There's a lot of things when it comes to medicine and medical philosophy and so forth, that one of the reasons I'm thankful to live in this country is that we're supposed to have the freedom to choose and to make those decisions. So I don't think that's what you're going for. Like, hey, if you get the same MRI and one's 3,000, one's 1,000, you go to the 1,000. But I'm just saying overall, that can also stretch to other areas that concern me. And I just want to make sure that our staff still has their choices. As Director Amos said, if they want to pay more because they are not a gambler and they would rather have that extra insurance, I just want to make sure that, you know, we're still giving them that option or whatever. Now, in the same token, we've got to keep the consortium viable where they will have no option, right? Or, you know, there was that's why I'm just throwing that out there, though. I get a little bit concerned when it's like, well, we know what's better for you, so we're going to help you with that.
That doesn't happen with these plans.
Yeah, and again, it's all voluntary. So the tool is voluntary. It's not required. You know, the tool is out there for people that maybe are going, well, I'm not really sure what to do, right? So we're trying to Dennis's point, you know, have people become more responsible consumers and, you know, go through this pathway to figure out what is best for their family. So we're not trying to replace it. And there still is a plan. And I'm sorry, I'm on my laptop, so I'm trying to figure out how to share my screen here. I have the comparison up, and I don't know if have you guys passed any of that out, Dennis, or do you have okay.
I don't know that, Chris, have you shared any of that with anybody?
No.
We haven't shared that with this group.
I thought maybe I had missed it. So,
It's big pack.
I was looking a little bit. That's why I'm like, I'm waiting for the punchline of what we're talking about here. So,
So ultimately, what we're doing is we're eliminating OC1. OC1 is a plan. It's the plan when I first started here. It's the same plan. And that's a long time ago. So, and it's a very rich plan. It's like the Cadillac of, and I've done my research. I've looked at all districts that aren't in the consortium surrounding us. No one has that plan. Our OC2 is the closest that comes to all the districts around us that have, and it's still a very good plan. It's an excellent plan. We don't have many people in professional staff in that OC1. Most of our people are already OC2 and OC3. So the idea was OC1 is going to go away. OC2 will be the base plan, the first plan, the richest. OC3, which does have a deductible, which many of our members have joined and taken, because it's still a very good plan. That will become the second plan. And a third plan is being created by the consortium members. That will be a little bit lower, a little bit higher deductible plan. So all members will still have that option of that OC2, which has no deductible whatsoever. The co-pays go up. You could say 100%, but that 100% goes from a primary care doctor of $10 to a primary care doctor of $20. For a specialist, it would go from 20 to 40. So even though it's 100%, it's in the grand scheme of things, it's a very small 100%. And that's an argument on her. The changes that happened, I supported. I was part of creating the changes. I thought they were smart. There are many people at the East Regional that are not happy because this is what we're doing, but it's what we had to do, and we had to make some adjustments. It was time, and hopefully we won't have to make some adjustments for a while, because this will help do all the things that we like to do, be fiscally responsible, but also continue to provide a high level of healthcare for our members. I think all three plans work. I'm not sure about the third one yet because we haven't created it. But the two that are remaining, I think are great options for everyone.
And every person matters, but number wise, it's going to affect a small amount of people within the district. OC1 is one of our least enrolled. So I don't think we'll see a lot of pushback, but
And there's one more plan called a POS that was like a HMO plan. It was equal to that OC1 as far as actual AV value. So that's going to be unlimited because they're the same. So we'll be back down to 3 plans instead of 4. So that's the summary of what happened. And also it's going to help our renewal rates. So it's going to help.
And yeah, and if you want to see that, we can share that. I know you also want to talk a little bit about the financial aspect of this. And I don't know if this is a time to do that. I mean, that's,
yeah, let's do it.
Okay. Well, Dan's going to that's his part. So he's the smart numbers guy. I feel a little less comfortable. I mean, I can talk high level, but he really gets the ins and outs like MedHat does. So, so Dan, I don't know, can you share your screen, like based upon, what MedHat put together? Okay. Thank you. And I know this might be a little bit hard. Dan will go through this slowly. And again, please, if there's questions, don't hesitate to stop them. Go ahead, Dan.
All right. So is that
Dan,
showing?
Excuse me, Dan, this is an FYI. We can't see any of those numbers. Can you put that full screen on your end or maybe our end? Unfortunately, we'd love to see you, but we'd rather see the numbers more than your actual self.
All right, let's see if I can figure this out. Is that any better?
No.
You're close.
I don't know if I'm doing it or if he's doing it.
Yeah, that's better. Yeah, that's pretty good. You zoomed in. That's not bad.
All right, go ahead, Dan. Thank you so much.
All right. Let me just make sure I can get back to the control here. Give me 1 second here, my bad.
Yeah, and depending on how you have like our pictures, I don't know if you could maybe minimize that part of it on your end. So it's only showing the presentation. I don't know. Like, I'm not as familiar with Google as I am with some other. So.
Janet.
Yes.
I'm gonna interrupt real quick. I just want to make sure that everyone's aware this is not affecting RX, not affecting drug prices. That's going to
correct. Yeah,
the
drug, we're not making any changes on the prescription drug right now since we moved to a new vendor. We want to see how that change and the financial commitments that CVS and National Cooperative made to us, how that pans out before we start touching anything on the prescription drug, because we do believe that there's going to be savings there, so we don't need to make the plan changes there. So this is only changes on the medical side. But from a rating standpoint, because we have everything blended with, and I think, Dan, correct, this has medical. Is this just the medical rates here, or is this medical and drug?
This is all together, I believe.
Yeah. Okay. So the impact is happening to the medical side, but because of how the rates are set up, that this is showing your medical and drug rate together.
I haven't seen this either.
We can't read the numbers.
So real quick, Dan, this is
Yeah.
Dennis. First looks didn't include the plan changes, correct?
Correct. The first look here, and I'm sorry, but the screen size. So this is the rates effective July of 2025. This was the July 2026 first look in the exact same 4 plans that you currently offer.
So Dan, go through the rates for Open Choice 1, which will no longer be available. Open Choice 2, Open Choice 3. What were our first looks
So these are the current rates in the light blue for
Uh-huh.
as of July 2025. And you can see here the corresponding first look rate for July of 2026 is for the single here, jumped from 1,011.67 to 1,087.16.
And what
And
was
that's
the, what
okay.
were the percents? Sorry.
So that was overall that was a 7.46% increase.
All right, that was for all plans or
Yeah,
just?
that was for all plans. I can take a look at them individually, but yeah, overall for the current benefits, renewing as is, our increase called for a 7.46% increase.
Now, the first look didn't add in, if I remember correctly, didn't have our rebates in for RX. Am I correct on it? Or
Gina,
they
do you
asked-
have that info? I'm not exactly
I'm sorry,
sure.
repeat that again. I'm sorry, Dennis, I didn't hear that.
Janet, our first looks, they
Yeah.
did not include our rebates yet, right? Or were they, or was there an estimate?
You know what? I apologize. I'm having people message me. Apparently, MedHead is listening in while he's driving to the meeting that he's going to. Do you guys see him on the call? Can you maybe he's set up as a viewer? Can you allow him to be unmuted? Is there a phone number or something that you're seeing?
We're looking into it, Janet.
Perhaps we can keep on pressing while we do this.
Yeah, so okay,
Yeah.
so we got what the first look is gonna be, but you're making changes to all this, so
Yeah.
are we gonna see what the changes are?
Correct. So just
Oh.
down below here, yeah, and sorry for the screen size here. So this is, as was discussed with Open Choice 1 going away. We have Open Choice 2 here, Open Choice 3, and then the Open Choice 4, which would be the new plan that was discussed as being implemented.
Which is showing as 0 right now since we haven't finalized the plan design. So the assumptions that were being made are only right now being made to the 2 plans that have been confirmed, which is this Open Choice 2, which as Dennis explained earlier. So Open Choice 1 goes away. We shifted the enrollment from the Open Choice 1 into the new Open Choice 2, along with the people that were already in Open Choice 2. And then the folks that were in Open Choice 3, we assume that they stayed, because again, we're not 100% sure where people are going to go based upon their choices. So we have to start out by making some assumptions on that. But I think you have to allow Dan to go from the starting point where at the top, which is what he was trying to do, is say, well, here's where we're at today. We know that we have to factor in a renewal based upon where we're at today. So that's the second part of this, which I want to say works out to about a 7.5%, right, Dan? 7.5% increase.
Correct.
Yeah. So, and then I don't know, Matt, do you want to? I know you're in the car, but
Hi, everybody. Thank you for letting me jump in. Just wanted to clarify a couple things, and thank you for letting me speak. The rates that we're looking at are medical only, because the RX change is not up. That's not up for negotiation and is not part of the redesign. So they are medical only. They are first looks. Rebates technically would not be in here because it's a medical only plan, and they would be part of the prescription for now. Okay. The idea is to take a look at what would happen first looks only, and then what would happen basically trying to figure out the value of the change of the plans that we're looking at. So the enrollment assumptions are going to be pretty important because we think people are going to behave that way because of the plans that they're already in. And then that's what Dan's going to go over now.
All right. Thanks, Matt. Right. So just starting, just back up at the top here, I think it's important just to identify the actuarial values of each of these plans as Janet was talking about earlier. So you can see with, if it was a 100% actuarial value, it would be zero cost share. The uh, to the employee would be a 1. So all of your plans are very rich at the moment, and as you can see, they're very close in terms of actuarial value. So that was the impetus for making any of these plan changes. So
Excuse me, Dan, what do you mean by
yeah.
rich?
In terms of the employee cost share being low, so the richness of the plan would be that the employee is paying less in terms of the components of the plans from deductible copays, things like that would be how we would assess the richness of the plan.
Thank you.
It's high. If you were to give this plan a metal tiering like they used to do back when ACA first started, this would be a platinum level plan, and that's where that term would come from. The richness of the plan. It's a platinum level plan. There's platinum, gold, silver, bronze, and this would reach that platinum level.
All right. So then, as we were talking about earlier, looking at the first looks, the overall increase here on the medical would be a 7.46% increase. We can see the dispersion of your membership throughout the different coverage tiers, as well as the admin, professional, and support staffs there. And then as we get into the purple, this is where we're looking at the proposed plan changes. So as you mentioned earlier, Open Choice 1 is going away. Looking at Open Choice 2, we took the enrollment from current Open Choice 1 and Open Choice 2 currently and put them together there, along with the POS plan, since that was relatively the same as Open Choice 1. So those three, Open Choice 1, Open Choice 2 current, and POS, the enrollment there is now included here in the purple Open Choice 2. And that these rates here also include the proposed plan changes that were discussed earlier. So you can see a little bit difference in rate here from looking at the first look. Rates changed a bit based on the plan changes. And then looking to the right here at Open Choice 3, that enrollment stays the same, assuming those members will continue to be enrolled in that plan. Also, you can see the updated rate here in the purple. That includes the proposed plan changes. And then Open Choice 4, no enrollment in that. That would be the new plan and the corresponding rate there, where you can see that actuarial value is lower than the other two, which corresponds to a lower rate.
And Dan,
So I'll pause there.
That plan that you mentioned there for Open Choice 4, that's not the one that's been fleshed out yet. Is that correct?
That's
correct.
That's
Yeah.
correct. Right. Yeah, correct. Sorry, I'm looking at something. Matt Hack,
Yes, sir.
what month did you put out first looks? I want to try and find.
2 months ago.
So that
Put
would
out first
be
looks.
December.
December or January?
Oh, it's December.
December.
Yes. And second looks are coming out this month, but we obviously have to go through the plan design conversation first to see where we're going with our second looks.
I know.
Do you have any questions?
So what does the 7.99% represent in the proposed plan changes?
So that is the assumption based on enrollment falling where it is. We're into the Open Choice 2, along with the plan changes in these two plans. That is the annual total here, and that is the increase from what you're paying currently at $4,165,000, increasing to $4,498,000, which is just slightly higher than what the first look was if we're renewing the exact same plans.
So, all right, so that's what's not making a lot of sense to me, because it would seem, so by getting rid of some of the of a choice, and I believe it sounds like some of the like co-pays and so forth are going to go up in open choice 2 and 3. The plan is actually increasing further than if we kept everything the same.
It's increasing less. All right, so if we didn't make any plan changes, it would be a lot higher.
Well, 7.46% is less than 7.99%. So that's where my confusion is.
You guys are
Is this
correct.
me? What am I
First- The first look is 7.5, and the second look, for all intents and purposes, is an 8. And the reason it's 8 is because of where we put the enrollment. We didn't put anybody in open choice 4 because it's not complete yet, and we didn't make the assumption on there. And we pushed everybody from open choice 1 to 2 and from POS to 2. And in the middle of that, it's a renewal. So that half a point is worth about $22,000 on an annual basis because of that change, only because of where we put enrollment.
Mm-hmm.
And by the way, open choice 2, in comparison to the new open choice 2, is actually an enhancement of plan. Open choice 2 currently is $20 copay for office visit. It's going to go to $15. And that's because we split the difference between number 1 and number 2. Number 1 was at 10 and number 2 is at 20. So the new one is now at 15.
Okay.
So they are going to see a better benefit overall, an improved benefit.
So while it's a
And that's-
7.99%, we would expect that it would go lower than that when folks have the opportunity to enroll with open choice 4. Is that that's sort of the leap we're making right now into this new plan change, if that's correct?
Absolutely
Okay.
correct. Yeah. And
So-
those that are in open choice 2 may also decide to go into open choice 3, and that will also come down from the 7.99.
Okay.
Any other questions? Well, thank you everyone from our Oswald team for joining us today.
Thank
We
you.
appreciate your time and your expertise.
Thank you.
Thanks, everybody. Have a great day. Let us
you.
know if there's anything else. Thank you.
Thank
Thank
you.
you.
So we're gonna jump to fund balance goal
All right. As
and
long as
cover
there's
that
no other
next. Is
questions.
that all right?
Yeah. Okay.
I would just like to add in the future, we need to make sure that these individuals are in-house and have additional paperwork for us so we could actually do a better job on it. Just find that when they're here in person, we have, we're gonna have more questions, more exposure, and more of a chance to ask them more direct questions. This type of format here, being that we can't see what's going on the screen and can't share the information, and we have nothing in front of us. I would suggest and highly recommend that in the future, they be in-house and have these documents prepared and ready for us. Thank you.
We need that too.
All right. So we are going to hit, I have paper copies as well. If you want some of these. This is a discussion. Okay. So this is based on the district goal this year to present a version of the 26-27 budget that does not use fund balance except for capital improvement, retirement spike, and Upper Bucks County Technical School. So this is a conversation that we're having regarding how we currently handle various areas. And then, you know, we're going to end with some direction to the team on where we're heading as we work toward the proposed budget in May. Sound fine? Cool. Okay. So this is the budget snapshot as of January 21st. So last month when we were together, the total revenue, the total expenditures noted, the total revenues noted, and then the initial deficit at $10.9 million. The adjustments to the initial deficit as presented on January 21st were to use $5.9 million for capital projects, $2 million for the retirement spike, with a tax increase of 3.5%, which would be about $1 million, which would bring the remaining deficit to $2 million. I revised this assumption that the board would not raise taxes to the full 3.5% tax increase. You may choose to do that, but for discussion purposes, I dropped it down to 1% tax increase, which has been closer to our history over time, which would be the targeted reduction goal of 2.7 million to be achieved by May 2026. Okay. So to eliminate or to reduce that $2.75 million deficit, the district will focus on 6 areas: staffing and enrollment, operations, programs, financing and capital planning, revenue, and then an other section, which I thought was worth noting. So staffing and enrollment, our current approach, as many of you know, has been managing staffing with declining enrollment by not recommending new staff or adding headcount, we can think of it that way, and to reduce administrative and professional staff through various means. The most common is through attrition. It's common here, not replacing retirees due to not replacing retirees or resignations to avoid furloughs. Responsibility adjustments, teacher certification. So teacher assignments, their certification areas are aligned with student needs, reducing the need to furlough. And then administrative roles, responsibilities are reallocated across the Act 93 group, and job descriptions are updated. There's also been outsourcing that has occurred, and this is, some of these have been decades in place. So capitalizes on expertise of a company or organization, removes PSERs and health benefit costs. So transportation has been outsourced since the 90s, I would say. Food service management, employees partial. PIM support, we do work with the IU to provide PIM support to the district. And then our substitutes, as you know, and we'll be discussing later, we all outsource that service. So with the furlough piece that we have avoided by and large, the next is 3 charts. I shared these same charts when we talked about buildings and grounds in December. So you'll see in 2020 what the student enrollment was at 1433. And then you'll see what our numbers were. Now, keep in mind, this was at the height of COVID. We were open full time and we created a whole virtual program. So our families were able to choose which approach they were most comfortable with. Our teachers at that point were at 159. We did have COVID funds to support a slew of online teachers during that year. So you'll see our full-time employees and our part-time employees listed in that first chart. In the middle, so that was the 22-23 school year. We were not using COVID funds. We didn't have COVID funds at that time for staffing. So our teachers, you could just go all the way down. Administrators were at 17, administrators were at 16. You could see secretarial staff, you could see teaching staff. So all of our employee groups are in the yellow, and you can see how many full-time and part-time. That year enrollment went from 1433 that we were looking at in 2021 to 1372. And then if we look at this year, looking at 25-26, you'll see again the admin has come down again to 14. Our teachers have come down again to 136. Everyone else has been relatively stable. Technology, maintenance, custodians have remained stable during that time. So that is just a visual representation of what it looks like to match our enrollment, which we're at 1337 this year, compared to where we were, 5 years ago. I'm going to stop right there. If you can go back to that. That's okay. That's okay. Everyone has it. Got it. So these are the approaches that we have taken to align declining enrollment with our staffing. Are there any questions on those before I move on to recommendations? This is the approach that we've been following.
There's still 10 on the list now. So it's come down from 21 to 20 to 10. Whereas with food service.
Actually, nine, yeah.
Nine now.
Yeah.
These are the folks that are saying.
Yep. The only thing I want to correct on that third slide or the third chart is that it should say 25, 26. It says 22, 23, but I just want to change it. Okay, let's keep moving. Thank you. So recommendations through retirements, resignations, continue to use the attrition teacher certification approach, not replacing a teacher at the top of the pay scale as far as money is, concerned. You're looking at $182,000 in salary and benefits. So that person is not replaced. That is a full savings. If we are replacing that teacher, we use both approaches. Replacing with a less veteran teacher yields approximately $61,000 in salaries and benefits for how we budget for that. Class size adjustments, assess class sizes at all levels, elementary, middle, and high school, and discuss whether to establish class size minimums at all levels. We run the gamut, I would say, as far as class sizes are concerned. We have some high school classes that are very low in enrollment. We have some middle school classes that may be a little bit higher. Elementary, we really tried to keep our elementary class sizes consistent throughout the district, and that happens starting with kindergarten enrollment and then putting students to keep classes as equitable as possible across grade levels. Benefit plans, we just talked about consortium changes. So consortium, as you know, manages administration of health insurance plans, and discussions are currently occurring regarding plan adjustments. Preliminary expenditure for benefits is $14 million. Second and third look will occur over the next several months. I'm just going to skip that because we just talked about this, and we're hopeful that there'll be some folks moving into some of those plans, and it'll impact our second and third looks from where we just discussed with Oswald. And then as a last resort, this has been my last resort, is furloughing. So a teacher has not been furloughed in the district since 2020. This was a part-time science teacher. Furloughs occur through seniority, for those that may not be familiar with this process. So the least senior teachers or support staff are furloughed first, and those employees are the least paid. So when you go this route as a, some sort of money saving approach, we have to go pretty deep before you're realizing savings, if that makes sense. Okay. Any questions on staffing and enrollment?
I'll bring this up. I don't know if I'm the only one thinking about this, but going back to furloughs, you say the least senior teacher support staff with furloughs first. Is that something that we have in writing somewhere?
Yeah.
Okay. And it's not by merit though, right?
Correct. It's seniority.
Not by merit.
Last in, first out type of.
Got it. Okay, thank you.
Yep. Okay, so operations. So these are things, again, as we did with staffing, these are an overview of previous approaches that we've taken with our operations. Energy management, Al has been doing an awesome job through energy management, so I'm glad to hear, so I can thank you for that. So demand response, our power curtailment times during the time the grid is in high demand. Palisades has been involved in the program since 2015. At board meetings, we've had our demand response folks come occasionally, and they'll recognize our work in demand response, and we can talk about the savings that we've reaped because being part of this program. Conversion to LED lights, Palisades began this process several years ago, and now 70% of our buildings and grounds use LED lights. We're still in the process of converting those over. Solar power, we do not operate by solar, but this is an area that we've discussed several times over the past 10 to 15 years. Each time it's been deemed not financially viable for the district, but we, continue to come back to solar to see if there is a time that it may work for the district. And then HVAC controls, currently have smart HVAC controls installed at the high school, Springfield, Tinicum, and Durham. POMS is proposed for the summer of 2026, and these systems allow admin to manage systems remotely and receive updates and warnings. Shared service agreements for various products and services. So diesel fuel, heating oil, we will be in the thick of those conversations in the next couple months as to where we stand with those products. And then services, Al and his team often work to share services. So trash hauling, elevator inspection, fire extinguisher inspections, boiler cleaning and repair are things that if Palisades were to pay for them independently, we would not get as good of a rate as if we joined together with either the districts or the IU. And then transportation with CRAF, again, it's been, the 1990s that CRAF has been, well, it hasn't always been CRAF, it's for student, but has been supporting the district and providing transportation services. So CRAF uses busing software to maximize bus routes with a certain number of buses. Currently, we have 34 in the contract. Any questions about our approach for operations? Sorry, the last one is school consolidation. So there's a board committee currently reviewing this option, expenditure reduction, revenue generation if a building is rented, or program expansion based on personnel approach. So what I mean by that is, if there is consolidation and there's a commitment to a certain number of staff, then those staff could be used in different ways. So think of it the same way as through attrition. When we're looking at teacher certifications, we're looking for ways in which we can support students with the certifications that we have. If the board chooses to keep their personnel headcount, which I described before, at a certain level, then there may be some of those teachers that can use to support other programs that the board's interested in implementing. So currently there's a demographic study that's in process. We submitted that RFP a week or two ago, and the RFPs are due at the end of the month. Prior presentations are posted on the website, so you can see everything there. And then the Bucks IU has toured each of our elementary schools and deemed each of them satisfactory for the purposes that they may have as far as an alternative, programming for schools or for our students. So recommendations here: support continued conversion to LEDs, determine cost savings with bus contract if there were fewer routes, which would reduce the number of buses, but again, this would mean longer bus rides. And then continue board review and consideration of consolidation. The committee is looking at that right now. And then explore additional shared services opportunities. So the ones that we have in place, and we can see which other shared service opportunities we can pursue. Operations.
I just have a quick question.
Yeah.
I don't think this impacts us at all, but
Sure.
on the financial report that is later on in the agenda, food service, looks like they're $189,000 in the hole. That doesn't affect this at all, right? Or does it?
No,
Okay,
food service is a separate fund.
okay. That's what I thought, right? So, sure. Okay.
Yeah, you're welcome. Programs. This is just this slide. Regularly negotiate lower costs with vendors based on our enrollment. So when vendors say it's a certain amount, a flat rate, we always negotiate something lower because we have more students. Regularly review academic program support software to eliminate redundancies. So Screencastify we used to pay for, and now it's Google Classroom. Newslia we used to pay for, and now there's a component of CKLA that supports the same type of learning. It is difficult, but we do it to reduce things that folks are accustomed to and enjoy using. So that is one of our approaches as well. Use of capital projects to support the implementation of large curriculum adoptions, therefore not increasing the curriculum budget. So we just saw that last year with CKLA that came through capital projects and not hitting the curriculum budget per se. And then using grant funds to support personnel. So title funds going to support our reading specialists, our state PCCD grant to support our social worker, etc. And then as far as recommendations, just continue the approaches noted above, and we can certainly talk about more in that area. Financing and capital planning. So this one, Palisades has extremely low debt based on the work that the board has done over many years to make that happen. We have one remaining bond, and the district has routinely assessed the benefit of paying off bonds if it was beneficial to the district. I think we just most recently talked with PMA, no, PFM. Got my letters on, but this is not the right time to do it, but we'll continue to work with our partners to make those determinations. Fund balance management. Again, due to fiscal management over many years, the district is able to fund capital projects in cash as opposed to seeking bonds that will add interest rates. Keep tax increases steady, not significant fluctuation over time, as pension costs climb due to retirement spike fund, which has been in place for over 15 years. So when that fund was first put in place, maybe we were at 21%-ish, maybe a little bit less for our PSERS rates. And now, as we know, we're up over, 33%. So because the board established that fund early, they have been able to mitigate those wild fluctuations and increases to support the budget in that way. We also routinely examine our investment income and make adjustments based on interest rates. I'm trying to think of the last time we had that conversation, but we do that annually at this meeting. Yep. So flip to the revenue side. 74% of the district budget is funded locally, income and property taxes. Our tax increases are noted. Thank you for the extended percentage there. Again, around 1%, anywhere between 0 and 1% has been our pattern as a board. And that's why making that assumption to look at 1% as opposed to the 3.5, that's where I got it from. 25% of the district budget is funded by the state through various grants, Ready to Learn Block Grant, PCCD, reimbursements for Social Security and retirement, and 1% of the district budget is funded through federal funding. So these are our E-rate funds, title programs, school lunch programs, Medicaid administrative claims, and so on. As far as additional revenue, grant writing continued to apply for non-state grants to support various programs. PCF's a great partner. Lehigh Valley Community Foundation is also a partner of ours when we're looking to fund specialized programs. Facilities rentals, they've been in place for years. We discuss these rates to make sure that they're on par with neighboring rentals. We really did really well with rentals when we were one of the only games in town with a turf field, but now that's pretty common. So we want to make sure that our rates are set so that people will still want to come here and rent. So that's something we take a look at too. Advertising we've had in place for years. Athletics, pay to play has also been in place for years to offset coaching and equipment costs, but that will come back to soon to discuss. So depending on reductions in other areas noted above, tax increase may need to exceed 1%. I think we need to continue to challenge assessment appeals as they come through, reassess rental and advertising revenue, consider increases where it makes sense to do that, and then to continue to advocate for special education funding reform is also a focal area. And then for other recommendations, again, continue to advocate with state legislators for charter school funding reform. I know we sound like a broken record, but we are making progress in this area. Continue to actively investigate residency cases, which we've been involved in for quite some time. Continue to challenge charter school tuition payments for non-resident students, and continue to partner with organizations such as Booster Clubs and Palisades Community Foundation to enhance current programs and opportunities for students. So those are the things that we have in place that we will be looking at, but I also wanted to share that it's a $2.7 million reduction that I just wanted to have that discussion to make sure that that is the target number that we're looking for. Or if you say, increase taxes to the index, I just don't feel as though I don't want to go on a percentage increase that I just do not believe would be the case for an increase. Now I could be wrong, but going on past history, I don't think that I am. I think it's a safe assumption. So to the fiscal committee, my question is continue on this path for the 2.7 and bring that in May, or is there any change in between?
Anyone? Questions? Linda?
Wow, well, I feel like there needs to be more full board discussion around some of these things, but just clarify for me, you have athletics pay to play
Mhm,
in place for years.
mhm,
We do that currently?
mhm.
And what does that look like? I don't know
So,
that I was aware of any of that.
$25 for,
Per student,
Per-
per season.
yeah, and there's a cap of probably 70, I think there's a cap, a family cap.
Yeah. I think the number, and I might be wrong on this, but I think it's about $78,000 is the realized revenue for the district from all the pay to play. Brian Gilbert could give us that exactly.
Yeah, we could bring it up at extracurricular.
Okay, it's 25 per student per season
Correct.
and a cap
There's
for
a family
families.
cap
Mhm.
per year. Per year.
Correct,
Per year,
yes.
yes.
I would be curious what that is.
And I think it's a number between 7,000 and 8,000 is the realized
Agreed.
per year.
Um, well, you know, again, just coming from experiences that I'm aware of, I do know that particularly private schools have to charge way more than that. It may be something to consider to look at increasing that. And what's the other thing that is going on? With the school consolidation piece of it, do we know if that needs to be slowed down because of the process in things? If we can work on that in pieces and offering just partial spaces at a time, would the Bucks County IU still be willing to look at that? Do we know?
So we currently rent to the Bucks County IU now. So we have classes and spaces that are rented throughout our district. So
whatever we could offer potentially may satisfy the need that they may have right now to just start.
possibly, but I haven't had more of a conversation than
Right.
them, the
Right.
committee having them come and tour our facilities and see if they're, viable spaces for their needs, which
Right.
they said that they are.
Right. So as far as like the staffing and enrollment of things,
Mhm.
I tend to look at things very differently in that, the idea of looking at certifications and placing people in places that they're not really intended to be concerns me. And I prefer to look at things where we could maybe create something on a, what do we call it? Karen, I always forget this word. Competency, thank you. Where we could set up classes that are based on competency level. So we're not looking at having all fourth graders having to spread them out and offer different needs for, say, their math abilities. We have a teacher that's teaching this level of math. All students at that level go to this classroom. This level of ability goes to this classroom regardless of, their ages and levels of grade. That's something that I just think would make more sense in utilizing the staff that are in positions that they've intended to be in and have the abilities to do. So that's just one thing.
Correct me if I'm wrong, isn't that
I
what we
think that's
do?
it.
So I think what Dr. O'Connell is talking about is that when we have a teacher that is no longer needed in a position and we have another opening, they might have come in as, say, a math teacher, but they have the certification to, say, teach science. Science, option opens up. So now we take that teacher and plug them in over there. I think that's what you were saying.
Understood, but I think we're using people in fields that they're not intended for, or that they didn't set out to get involved in. But I'm just saying that I think we need to look at developing a space where we're at least beginning to experiment with doing it on an ability level and try to arrange that and try that. I think it might eliminate the need for some of these other positions that we're looking for, because we are looking, Scott, to actually offer and bring in support. So when we're looking at this kind of thing, it doesn't leave room for us to do that.
Well, I
very
think that's part of the
easily.
problem is saying you want to get to a zero budget, like you can't have your cake and eat it too. So I think
Well,
that's
that's why I'm suggesting that we look at a different approach to it. And
All right,
so that's
I
where
guess I don't
I'm
understand,
saying-
but I'm not trying to be out of my lane. I just, from being here 12 years, the whole, and I think you're absolutely right. There are teachers that get upset because they've been teaching in a certain area. And I totally get this. Yeah, like I get both sides of it, right? They've been teaching in a certain area. They've built up a proficiency in that. They've built up a familiarity. They've got their stuff from years past that they can, pull from. And all of a sudden we say, oh, we got this opening over here, and you're also certified in basket weaving, and we've got a position over here, so boom, you're going to basket weaving. I haven't taught that in 10 years. I don't have anything built up for that. It's not what my passion is anymore. So like I get from the teacher's perspective, and I don't think it's good as a district perspective or for that individual teacher because of all the negativity and just them having to relearn something new, and it's not where their passion is. But then in the same token, what's our alternative, right? If we have that opening, that teacher doesn't want to move, but now we don't have a spot for that teacher anymore. Where does that leave us, right? Like,
if they're certified to teach the new program and they have seniority, that's where they go. I mean, pretty much.
I'm just
again,
looking at because
right.
I've also been on those interviews, right? When a teacher's trying to get hired, they're highlighting all those things on their resume, but I'm certified in and then unfortunately, sometimes 5 years down the road, that comes back to bite you. So, in a perfect world, everybody would just teach what they wanted to teach, stay in their field. And I want to try to make that happen as much as possible. But I also feel the same way as you do. We're finding the need for supports and whatnot.
Correct.
And that's where we get the problem with
that I think we need to have
where's
more
the money come
discussion around. Exactly. And I think if we could look at offering it performed a different way, it may meet that need. I don't know, but this is where I think we need to start having that discussion. But
that almost seems like an EPS discussion versus a fiscal discussion.
Well,
And then we have to come to, EPS is going to have to come and duke it out with fiscal.
Yes and no. Yes and no, gentlemen. EPS could say this is a fiscal issue because we need to have support get it for us. So help me out here.
Yeah, so I was going to say that, we're looking at a pillar here of our budget. And of course, we gave Bridget a goal that says present, a balanced budget. But, on other pillars, number one, the one that I care about the most, student achievement. And we did talk about this at EPS, that, we need some help and support for, I believe, our middle school level. And that's certainly not gonna, help Bridget in the pillars that she's trying to put forth here, when I'm saying let's add more staff. But the bottom line is we need more staff at the middle level that focuses on instructional support for our students. So, how does that come in here? And that was discussed at EPS. So I think back to Linda's point of as a board, and I know this is what Bridget is looking at that from us. What is our recommendation? What is our recommendation? We need to decide that.
Yeah.
Right.
Yeah.
Well, and I would just say, just to try to keep us moving along here, first of all, you're in a very difficult spot. So let's just throw that right out there. But I think it's ultimately going to come down to you having to say, like you just made an assumption. Also, I know the board doesn't want to raise, taxes more than 1%. So you said, we did the Act 1 index, but figuring that you're not really going to want to do that now, we're at 2.7 million deficit. Honestly, I think since you were tasked to come with an option of a zero budget, that first of all, you should just consider it at 3.5. Okay, don't make that assumption because that's going to be up to us to figure out. The board said we want you to come to us with a zero budget. Then do that. Okay, and that might mean 3.5%. That might mean you come and saying no more support. As a matter of fact, it means we've got to X these 5 positions.
Right.
Okay, It might mean something like our participation in Act 319 in the farmstead. Maybe that goes away because that's about $75,000 a year I think we throw in. Maybe it's what Linda just said, that we make all of our students pay double or triple. Okay, like, don't get me wrong, I am not saying I'm in favor of any of this. Okay,
Yeah.
but that's how you get to what you were asked to do. And then as a board, we've got to say, okay, zero budget is important to us. We're going to put all this into place, but then these are going to be the ramifications. Oop, okay, well, we wanted to see what that would look like. That's not where we want to be as a district. So we're going to have to use fund balance and know that throughout the year, okay, we do everything we can to keep costs lower. And just like last year, $300,000 or so was actually, excess.
Yeah.
As opposed to having to jump into that fund balance. But we had that fund balance as that gap.
Correct.
If those things came in that we don't know until the year happens. So.
Thank you, Scott.
I would still like to see if we can create a formula that we will utilize as far as what is reasonable to keep set aside, right, as our savings account.
So we have that.
Right.
We don't have a formula, do we?
We have a percentage.
For policy.
So do we not have like over $38 million sitting somewhere?
I believe it's 30.
Okay, 30. And that's sitting where?
Some of it is committed to capital projects, for instance. Some of it is assigned to this year's budget. Some of it is committed for retirement spikes. Some of it's committed for upper bucks. Some of it's committed for healthcare.
That's L on the agenda, right?
That's correct.
So there's
Yes.
17.
There's more than 7.
Oh, no, I'm reading it. I'm sorry.
So just for time, okay, so do we have any other questions? And I just want to thank Scott for bringing that up because it was on my mind. Absolutely, Dr. O'Connell. We're asking you for a major task here. And you know what? Bring the good and the bad. I said, this is how I'm going to get to it, but hey, this is the only way I could feasibly think we could come about it and throw it all at us. It's for the board to decide. And thank you so much for bringing that together. We appreciate it. Now we have to get together as a group and say, okay, do we want to go with this or go with that? Bring the whole kitchen sink, part of it, nothing, doesn't matter. Throw it all in the mix there and say, this, if you guys want zero budget, this is how I came up with it. Okay? Yeah. No one's feelings should be hurt when they see what comes out. This is the reality that we all live at home. We want things to get done in our own houses. We have to put the pencils to the paper and get to where we need. And then we look at Johnny, Jane, and the dog and say, oh, sorry, no car for you, and looks like no kibbles for the dog. Yeah, I don't know what to tell you, but we're gonna have to do what we need to do to get to where we need to get. But we're asking you for a heavy lift, and just give us the information. And it's this committee here and the board that's gonna say yay or nay. I'm gonna go with that, and then we'll go in the back room, put our gloves on, and duke it out.
Okay.
Okay.
Understood. Thank you.
Thank you.
So the next item on our agenda is the Timken water tank. Now,
Yay, water tanks.
Well, as you probably all know, I've got a closed tank going for 2 days. Back in February 2nd. And February 3rd. Just gonna give you a rundown of what happened. 6 a.m. I received a call from Bob Cox, that's in the chief. He reported to me that we had a pretty substantial leak on our water storage tank. The tank itself is a 1,500 gallon polypropylene tank. And it's housed in the mechanical room, which is at the end of the new wing. The initial inspection looked like the 4-inch fittings that supplies the pump from the tank split. So I contacted Dr. O'Connell with the situation and recommended closing the tank for the day until repairs could be made. And we had the tank drained, so we're going. I contacted several commercial plumbing contractors and none of them worked on poly tank. Jim Steele, who's our sanitarian from the S&G. family company, it's called Coastal Technical, which are right in Montgomeryville. And they work on this type of storage tank and they install them as well.
Thanks, everybody.
Yeah. Sorry to interrupt you.
Thank you.
Okay. So, we found a company and they were prompt, they were actually out in less than 2 hours and they actually had the flange that was needed. So they did the repairs, of course, everything needed, curing time, the glues and the sealant needed curing time. So S&G was scheduled to come back the next day and hook the tank back up to the system. So, okay, I'm sorry. It was reported to me at that time by Coastal that the tank itself needs to be replaced due to multiple stress fractures around the flange at the base of the tank. He could not guarantee how long the repair will last. On Tuesday, February 3rd, S&G finally located all the fittings and flex pipe needed to hook up and arrived around approximately 1 p.m. and repairs were made. Glue was cured and the tank was filled and the water system back up at 6 p.m. So we had school then on Wednesday. Again, the tank itself, the report I got from S&G, the existing 1,500 gallon tank is made of HDLPE polyethylene. It was manufactured in 2009. The tank has stress fractures in the tank at the tank flange, which is the very bottom of the tank itself. Due to the method of tank construction, it is not repairable. The existing flange was replaced and flex joint was added, but the tank is still leaking in the area of the flange. The tank needs to be replaced as soon as possible to prevent full closures in the event of tank failure. And our supplier has a tank available and is subject to it, but it's subject to a prior sale. They said they could do this. They could do this on a weekend, on a Saturday, and take the old tank out and replace it and have it up and running in basically in one day over the weekend. And we're willing to do that. So I have a quote for finishing, replacing the tank. That includes delivery, installation by the subcontractor, labor and materials to remove the existing tank, dumpster rental for old tank disposal, rental lift for tank handling activities, connections as required to hook up existing piping and electrical to the new tank. And the quote came in at $12,895.
What's the question?
The question is, do we want to do that immediately?
So it was definitely an unanticipated cost that came up sort of out of nowhere. We were thinking that the tank with the repair would hold, but clearly from the work that was done, the tank itself is end of life and we needed to bring it. And you were the first, you were the first. So if the committee approves, we can have it on the board agenda because it's, certainly not part of the budget that you approved before. What's the cost of it again, Al?
$12,895.
Yeah, and it's a little, it's higher than.
I have a question for you, Al. So the fitting split at the elbow?
It wasn't the fitting, it was actually the flange itself.
The flange itself?
Which is attached to the poly tank.
Yep.
Okay.
Yeah.
So that wasn't really the main problem. The main problems are stress fractures where the bolts were bolted in.
Okay.
And that's
Right.
what they're afraid will.
And this is an outdoor tank?
No, it's
An indoor tank.
mechanic water.
Okay.
That's a lot of water, 1,500 gallons.
No, absolutely, absolutely.
And it's down. It's not like the water's gonna run outside anywhere. It's gonna stay there.
Right. No, it needs to be replaced. We need water there. I'm of the mind that that's something we should agree on. Any other thoughts and questions? It's a life support thing. You need it.
Yep. that would include, you know.
Yeah.
Not to mention water damage that would happen.
Right.
Yeah, that makes it worse.
Get the geothermal pumps or everything around the thing.
Geothermal pump, which pumps are, yes.
Okay, do it.
Yeah. Is
Think
that,
so.
so the tank that they're replacing with the same exact tank, or is it an upgraded model? Something we're gonna get more life out of it? How's that for a question?
I would hope so. I will ask that question.
Yeah, absolutely. Because for a few dollars more, if they could get us a better tank that will last 20 to 30 years as opposed to this one lasting 15,
Yeah, 16, yeah.
16 years.
Yeah.
I mean, that's the only reason why. If we're already gonna be in there and replace it, and you upgrade it to a point where like, hey, you're gonna give us a 20-year guarantee, 30-year guarantee, whatever. But it's just a thought. We're gonna replace something on today's dollars as opposed to the dollars down the road.
I'll ask that question.
Okay, thank you. Thank you very much, Al.
They put some sort of fittings in that the vibrations from the pump won't get to the tank anymore,
Yes.
which is
It's
probably
got a
what
flip. That could be
caused
part of it. Yeah. That was installed by S&G. That was one of the things they had a heck of a time finding all the parts needed to hook it back up. So it now has a flex hose on it.
So the flex hose will
Absorb the
take
shock.
this
Yeah.
stress out of that flange, at least the vibration out of it, hopefully.
And just out of curiosity, how much were the emergency repairs?
I don't have that yet.
Okay. So maybe, yeah, okay. Thank you. Thank you very much.
All right, item 4C, Susan, revisions of substitute teacher rates.
I apologize. In January, you approved these rates for 26, 27 for the sub. When I looked at them again with ESS, the retired PA certified teacher half day, I did not have 170. I forgot. I left it at 80 and I did make it 85. So because of the error, I had to put the rates back out on the agenda in February. And then the second is Exhibit A. We do this every year. It is the sub rates, then the percentage increase of the bill rate that we pay for ESS for the 26, 27. When there's a sub rate increase for us, we have to redo a new ESS rate that is on after if you approve it at the board meeting.
ESS gets a percentage
Increase on our rates.
percentage increase or just a percentage of what we pay?
Percentage on the base of the day. Like, so we pay a teacher 170, they get a 30.9%.
Okay. If they don't
fill, then we get 90, there's a percentage we get back. Yes, at the end for teachers.
Okay, so their ESS rate is based on 100% fill.
At the
And
moment,
what they don't fill, we get their percentage back or where's
at the end of the year, only for professional.
Yeah, so that's set within the contract that we currently have with them, and right, so their contract is not open. This is just
Just this Exhibit A.
okay.
Correct.
All right, because we are going to need to see about making some changes when the contract comes up again, but that's in a couple of years. I don't think it's
Correct. Yep. I think it's just a year.
Are we good?
Where we are, thank you. Any questions? Thank you, Chris. Thank you.
Thank you.
Yeah.
Thanks, Susan. So 4D is the governor's budget. Let me try to just walk through this quickly. Basic ed funding is flat for us. Ready to Learn block grant funding is flat for us. Special education funding is going up less than 1%. PSERS or security, the formulas are set by law. There's no huge windfall for Palisades in the governor's budget. Most of the new money in education is going to the equity formulas. So it's going to your Reddings, your Allentowns, and those school districts like that.
I did see something in there about charter school.
Yes, there continued movement on charter school. It would increase the amount of the deduction for certain categories like maintenance.
Thank you.
So
Thank you, Chris.
Our contribution to the charter.
Right.
Slightly. It would be a small movement, but still it's a very positive move.
Right. Any question? Thank you, Chris.
Okay. Next is community survey RFP review.
Yeah, so, this was brought up at our last fiscal meeting. Is this included?
It's included in the
Oh, awesome.
agenda.
Does anyone like, okay. So, this will be very similar and familiar to those that were at Buildings and Grounds last month. This is an RFP that's modeled very similarly to that one. So this is a community climate survey, service that we're seeking. The purpose is noted there. So I want to make sure that is accurate as to what we are, surveying. So Palisade School District is seeking proposals from qualified vendors to design, do we need these? Yeah. Administer and analyze a comprehensive community climate survey. The survey will target 3 stakeholder groups as parents, guardians, district staff. Establish a baseline of school culture and identify specific areas for improvement regarding equity, safety, engagement, and emotional well-being. You could change anything in there. Background information is listed. Scope of services are listed. As far as survey design and customization, administration, analysis, and reporting. I did work with Gary to make sure those technical qualifications were correct. What the submittal must include, and then as we did last month, let's decide.
Well, so I have a question. I didn't realize this was going out for RFP. I thought this was like, we're just gonna call around and get some prices for companies that do this kind of thing. So this is.
So an RFP will clarify what everyone is seeking. So then everyone can, there's no cost in doing an RFP other than, I mean, is there a legal notice? And then we post it on our website. So everyone has the same information. This is, once it's decided by the.
I thought for RFPs, we had to advertise in certain publications.
Just a legal notice, yeah.
Right, but I mean, I remember Buildings and Grounds talking about RFPs when we didn't want to do it versus quotes and like, well, it's a couple $1,000s. I thought we were told to do an RFP.
No,
Okay,
I don't remember what I want to say 100 something maybe for 3 days, 2 publications, 3 days.
okay. And what's our feeling that the average company is going to see that legal notice to give us a pricing on this?
Yeah, so we can send some out. I mean, go ahead. No, you do it. You do it. You go.
I also sent it out to the companies that were referred to us. So I sent it right to those companies so that they would be aware.
Okay. All right. I just think an RFP is a little bit overkill, but if that's, what you feel is best.
I just think an RFP helps me understand clearly what it is that we're seeking in the survey.
Well, we could get that clarification without doing an RFP. So, but once again, whatever you think is best. I mean, clarification, I think 100%. So
Yes.
however you achieve that, so.
Paper's better.
Right. Okay.
Then no worse for sound lane. Get it down in writing.
Oh, yeah, no,
Everybody's on the same
clarification, black and white, I'm all about that, absolutely.
So Dr. Connell's question is, what she has down here as the scope and what we want out of it, is that what the scope and what we want out of it?
So for me, I think there was some, this was not exactly what I was thinking. So to start with, on the purpose aspect of it there, I mean, we just did the comprehensive plan, with all of this, and not that we don't care about doing a third-party one for students and parents and guardians and such, but I believe, if I'm understanding, and it shows forth in the comprehensive plan thing, in trying to develop a 360 program and utilizing a third party for the anonymity of it in developing that 360, this pertains more to employees of the district. So if we're just providing it to employees of the district, then that would pretty much eliminate the need for part 3 in the design, including the multiple languages and all of that stuff as well.
So that's helpful for me to understand, because I thought this was we just did a comp plan, but I heard that we wanted to do another one with a third party vendor.
Well, but for the purposes of trying to get to a place where for the evaluation processes, we're doing something that looks more like a 360 of getting input from all levels of people under staff and so forth. Correct me.
So this is an evaluative tool that we're doing.
I see the 360 as being different than this climate survey. I see the climate survey, like, I agree with Scott that I didn't think we had to go for RFP, but the purpose piece and the climate survey and things as you had it here, that's what I see. And I see that different from the 360. However, a company who does surveys and things like that could help us with a 360 format. They could.
Okay.
But I do see what Bridget has here as what we were talking about for like a climate survey.
Okay.
I do.
I'm confused.
Welcome to my world. In terms of what the difference of the two surveys.
I don't know what we're survey. I don't know what it is. But the outcome
Thoughts?
should be.
Any other thoughts here on this topic? So if I understand, right, we just had a survey done, the comp plan,
Correct.
360, and had covered aspects of what was in that survey. If this is a survey that I've been trying to bring forward as a climate survey, and this is what we're trying to do here, climate survey, in my mind, is to see what the faculty and staff and anyone that works under the umbrella of Palisades School District specific. So we've already done numerous things with the community, and we save time and money with just doing something with the physical entities that are under the PSD umbrella.
So parents and guardians would come out.
Yeah, we've already done so many with them. This would be just strictly under the PSD umbrella staffing, going from your position, Dr. O'Connell, all the way down to the wonderful people that keep these buildings clean and safe for our students.
Would it include students from your perspective or not?
Well, if you include students, then you're including the community, right? Right, and have we not done numerous surveys where the students have inputs and then they sit down and give us their opinions? I'm confused if we have or haven't.
Yeah.
So students were part of comp plan, and Rich is here, so he did all the surveying with that as well as with district staff
Comp plan was grades 5 to 12, I believe.
and district staff.
Yes. Yep. Both.
Right. Am I the only one thinking this, or
Well,
should it?
that's kind of what I just thought that my perspective was going to be, at least initially. Like where it goes from here moving forward, I don't know. You know, if this would be a company that would be utilized then when comprehensive plan rolls around again, okay, but at least for what we're looking at right now, that was what I was expecting was around the staff, all staff, employees.
I thought from what was said at the board, I thought it was all Palisades area, so students and you know, all stakeholders. But I mean, I'm open because I got to be honest with you. I don't know that it's necessary for the cost that there's going to be, but I'm, you know, willing to take it step by step. And the next step is, well, what's the cost? But I thought we were talking about all inclusive, but that's not a must have on my end, you know.
And going back to what we've discussed here, students and parents and guardians and staff, if it's a climate survey, sure, make it all inclusive. Why not? Because at the end of the day, when we move forward with a comp plan or something like that, you're going to have to send it out to everyone. So if we have some sort of vendor, outside vendor, that can handle this, and in the future alleviates the pressures from the staff from taking care of it, so be it. But I'd love to see And I would like very much to see some sort of robust climate survey of our school district.
But just in-house district, not students and.
You know what? You can include them all because they're going to be the same question. It should be the same questions. Excuse me. At that point, are you doing this?
Different questions?
Yeah, that's
yeah,
and that's
that
what I'm
might
getting
make
at.
it more
And that's what I'm getting at, right? And so just because of my background and my affiliation with large organizations, the climate surveys helped us very much to move the needle where we needed to go. And when we're dealing with the population of the faculty, staff, and everything, those are the wonderful people that keep these things moving in our district. Without them, we're nothing, right? And so just to get honest feedback, say, hey, this is working for us, this is not working for us. Can we move this? Can we try this? It's helped many a time in my own personal professional experience outside of where I used to work before. And I see a lot of benefit from it. Now, I could be the only one, but at the end of the day, you will hear or see, people will say things in one area and not say them in an open forum. I get it. People are shy. They don't want to talk like that. They don't want to be known, whatever like that. But on the flip side, sometimes you don't know all the great things that are going on either. What's the saying? You hear bad news first before you hear good news, or you hear more bad news than good news. But you'd be surprised. You'd be surprised. And I just think we have an opportunity here to try something to give us some more information. So as we make tough decisions here in this fiscal meeting, where our money's going to go, this is another tool that we can use to move forward. And there will be some tough decisions this year. There will be some tough decisions coming up real soon. When you have a deficit of over $2 million, we want to know where that money's going or how we can take from Paul to give to Peter. It's just another tool in our toolbox to help us. Climate survey I believe is a great tool to help us with everything that we need to do here, but it's not going to get any better. Inflation is going where, Chris? Only one direction. Only one direction. And then you have a lot of toughness going around here. And climate survey just might help us out to make the tough decisions. Based on the survey, we said, hey, people want more of this than that.
So I would just say the point that we're at here is with, what are we asking for? Is it just for staff, for a quote, or is it the whole thing? I mean, I think that's the direction Bridget needs, and then the board's gonna have to look at, the fiscal committee, then the board's gonna have to look at, here's how much money it's gonna be, and then you'll get to restate that speech,
That's fine. That's fine. I'll polish it a little more for us if we need to. I say that we should just do with the employees under the PSD umbrella. And I say we work with that because those are the employees that we tell. Rich Heffernan, he's an administrator. He has a budget. Hey, Rich, that's a nice budget you put out for us this year. But at the end of the day, based on the survey, people are asking for this or that. So I mean, it's only going to get worse with numbers, and this is going to help us, in my mind.
So could I, what's just coming to me, that if we're going through this formal process of RFP and everything else, give us both options. Give us the cost for just an internal survey, and then also what would the addition be with this population, putting it out to all the stakeholders? Because we may, first of all, the board may talk and say, yep, we're doing it all in.
Yep.
Or we might say, okay, just staff right now, but then a year from now, we've got at least those numbers,
Yep.
they might need to be updated, but we've got those to refer back to.
All right, I'm trying to have a hard time deciding what the difference between this survey and what the comprehensive plan survey did. It sounds to me, the only thing I can see different is that you're asking a third party to do it, instead of in-house.
Well, that's a huge piece of it. And the other piece of it is there's opportunity for the board, correct, to give input on what those questions are going to be. Am I
Well,
right?
that's,
Right.
yeah, that's the second part of it, yeah.
Yeah.
What are we asking? What do we want to know?
Well, the board needs to have some discussion.
Start writing down
That's
your
for,
notes,
that's for
Jim.
another meeting.
Yeah.
Yeah.
that's fair enough.
Start jotting down your notes, Jim.
Now you know where I am.
Hey, so we define things.
So, just for notes purposes, you'd like to see a climate survey which includes internal employees only and another to include the entire community.
Costs for both. Yep.
Yeah, calls for both, yeah.
Our community and employees, yeah.
Okay. Anything else on that subject?
Well, did we want to look through some of the rest of that then? Because if we want to make this a third party, I'm not sure that I'm quite comfortable with on part 3, having a live participation tracking in helping us pivot for the outreach efforts. I'm not sure if we're talking access to a system somehow or what that means, but
I think
I
that
think
would
to
mean
me
that
it
the
needs-
company has tracking to try to help us get a better response rate.
Sure.
That's
so
not
the
in-house
company would,
tracking.
so the company would communicate with us what level of response we're getting. So it's more of a reporting to us. And then if it's looking low, we can say,
Well, and the way that they're getting responses, because this could go out in different forms, and they can say, well, we're getting a response, we're getting a 5% response rate from this platform,
mhm,
we're getting a 2% over here, and that gives us, greater information on how to get responses up. At least that's my understanding. I'm
correct.
certainly no expert in this
Okay.
whatsoever. So.
okay, so it's just feeding information to us as it's ongoing. That's what you mean by live?
Yeah, because
Yeah.
you want your response rate to be, and again, depending on which groups you're surveying, if you're not hearing from, they're gonna have to describe themselves. They're gonna have to say, I'm an elementary teacher. I would imagine you'd want to know.
Well, yeah, we don't know that yet. So, but at any rate, okay, so I just needed clarification on that, because to me, that looks like live participation in tracking that we are somehow going to know by being plugged into the system somehow. And that totally does away with the
that's not the way I understand
anonymity of it. So, okay.
Good
Um,
question, Linda. Thank
Yeah,
you.
yeah. Absolutely.
So, and the analysis piece of it then as well. We're looking there, it states about an overview. Executive summary, high level overview. Somebody else tell me, like, I actually appreciated from the comprehensive plan being able to see actual data and responses submitted. So
that's the disaggregated data. So you'd be able to see that from broken down by those groups. That's why I said you will know if someone's responding from Tinicum. If you want to drill down to that level.
well, if we do something that's considered like this high level overview kind of thing, can that be done with multiple sources? Like, would that be done through technology? Face it, AI. Is AI going to do that? Because that is what the comprehensive plan did, correct? Rich, right? The comprehensive plan, didn't Michael put that through AI and get that overview thing of everything? And yet I believe those platforms, or whatever they're called, don't ask me what the right term is, can produce different analysis of that. So as long as we can have multiple analysis given and not just from one source. Does that make sense?
I think that would be in whatever comes back from the vendors. And then maybe that's a follow-up question,
Okay.
is saying, well, when you do your executive summary, is that an actual person doing that? Is this an AI platform?
Okay.
If it's an AI platform, can you use multiple platforms? If it's
Gotcha.
if it's
So
a
that's a
human
vendor
doing that,
question.
who is the human? What do they know?
So
What are
you're-
their biases?
Yeah, so you're saying that's
Unfortunately, it goes all the way around.
a vendor question.
I
That's what
I
you're
think
thinking.
so. I mean,
Okay.
that's,
Okay.
and I think it's a good question, very good question, but.
Okay. All right, that's it for me.
just one, and again, not to beat the horse, but you know, back to what Scott said about looking at the two prices, I totally agree with that. But when we originally talked about the survey, we were looking at examples that other districts had sent out annually to all people all across the board. In the comprehensive plan, we have 360 staff feedback. Provide an anonymous feedback system for teachers and staff to give constructive input to building and district administration. So that I think is separate and different from what we are looking at.
Because
for
that's
this.
current comp plan that has not been approved by the board.
That's correct. You got it.
Any other questions?
I hope not.
Thank you.
I'll just fill in the timeline and I'll let you know where we're at.
Okay, item.
Not yet.
Oh,
I'm
not even
halfway
close.
through.
Item,
Donuts down there. if you need some
Last
sugar.
day.
item G is BCIU 22 programs and services budget. The increase for Palisades is a hair over $700. Okay. Any questions?
Nope.
Item H. Apparently the school district has used Christmas City Studios for student and staff photographs for a number of years. We never had a contract. So this is to put into place a contract. The contract is out at the solicitors for review.
Right.
And yeah, I've always wondered that, quite frankly, like, are they the only game in town? Do we get
No,
quotes from other
there's,
companies?
Life Touch is one of them. I think
Life Touch and Christmas City are kind of the two.
they are.
players
We've been with
there.
Life Touch previously. Christmas City at the time offered some other
Yeah.
items for us. I mean, but we've been with Christmas City for,
Yeah, and I
long
think our elementary buildings have recently gone to Christmas City
Mhm.
from Life Touch.
Okay.
those are like,
I mean, I'm not looking to overly complicate everything. I'll just
well, there's
try
a
to
market
pick-
there.
I'll
If
try to
someone
pick
wants
and
to be a
choose.
third party.
But I have
take
often
pictures of
wondered,
kids.
like, you know, like, why is it always just this company?
Yeah, it's big.
You
was
know, and do we look at pricing? Do we look at
Mhm.
availability? You know,
Mhm.
A lot of it is, can they cover all the events? It's kind of a tough business to cover a lot of the events, especially,
And Christmas City is close. They're right nearby.
and they have an office in Quakertown.
it didn't feel close when I had to drive up.
Why wouldn't you say the same?
They have an Upper Bucks office now.
Oh, goodness.
Oh, really?
Moving south, I guess.
Yeah.
Oh,
I don't know where it is, but there's one down there. So,
All right, well, if everybody says we're happy.
Chris,
it's
just for the
fine.
committee, that's a yearly renewal contract.
Well, no,
Uh,
it's never been. That's the.
No, the one that just said that, yeah.
the contracts in front of you cover this year and next year.
Yeah.
This year, next year. Okay, thank you.
Very good.
Do it.
Okay, item I is the renewal of Conrad Siegel for GASB 75 actuarial study. Let me explain what GASB 75 does. So when staff retires from Palisades, they can buy into our healthcare at the same rate that employees can. But retirees have claims that are greater than the average employee.
Yes.
If you have, as you age, your healthcare experience is different. This measures that different across the pool of promises that you're making to current employees. So it is stated on the government-wide financial statements, not the fund level statements. So this is not a liability on the general fund level. It's a liability at the government-wide level. But you are required to have an independent actuary do the study. And so this is a renewal. Conrad Siegel covers more than half the school districts in the state.
Just out of curiosity, the retirees that buy into our health insurance that's offered to our students, our administrators, teachers, XYZ, and they buy in at the same rate as when they retired, pretty much. Right, and then is there a cutoff period to a certain age where they have to fold into Medicare, or do they take that?
You want to say this, Dina?
Their rates renew every year, just like the district renews. So yes, the year that they retire, their rates will be the same. Now they're paying full cost. They're not paying a deductible or a copay amount. They're paying full cost of insurance. So the year they retire, they pay that current year. The next year, they'll pay whatever our rates go up at that point. Employees can stay on the plan until they're 65. At 65, they need to
At
be
65.
terminated.
But there's still an incremental cost to the plans because our experience gets worse.
Right. Absolutely right.
And
Understood.
measuring that experience worse is
Right.
what GASB 75 does.
They measure that, is what you're saying. That's
Yeah.
what that company does, measures. Okay.
Thank you, Chris.
Jump to the next one. IDEA 619, we get about $1,000 a year in IDEA 619 money. It's for K-5 special education services. We simply will use the $1,000 to offset the big IU bill because we buy some K-5 services there. This is an annual item. There's nothing, it's perfunctory. Item K, the public school improvement facility grant. Al, do you want to take this, or Colleen, do you want to take this?
I'll continue.
Gotta be quicker.
Yeah, right. I went like this first.
So this grant for improvements, both like roofs, HVAC, which is what we put in for upcoming projects that we have from the 5-year plan. The high school roof needs to be, the rest of the flat roof needs to be replaced. That came in about 1.9 million estimate. And then the upgrades that we had for Springfield, which would be an electrical upgrade and all the HVAC upgrades. That was done by Snyder Hoffman a few years ago. The study was done a few years ago. I had them update the prices, and it was like $2.2 million, I think, to do everything electrical. So
A few things, the projects have to be $500,000 or greater. There has to be a 25% local match.
Right. So
we were trying to look at meat and potatoes projects that seem like they fit the criteria in the grant. We'll put in for it. We'll see.
what happens.
Yeah, I was looking at the paperwork. So you definitely had the high school there, you had Springfield, and understood.
Those two.
Those
Yeah.
two.
We're gonna hit 5 million. We're gonna go for 5 million. Cause why not?
5
Do we know
million is
how-
the cap of
Right.
what we can
Yeah.
do.
Right.
Do we know how long it'll take to hear back? On
That's a
it?
great question. Yes, I do. The people of the state told me they will make a decision in the fall of 2026.
Right.
So we couldn't apply for any projects that are going to happen this summer. We had to look at a horizon further. And then another follow-up question you might have is, when does the money have to be spent by? 2029.
Okay.
And if I'm not mistaken, they have an amount of like 125, 129 million dollars that they're willing to offer. Something like that, right?
Yeah, it's a small pool.
Right, it is. It is. That's what I'm getting at. Thanks, Chris.
We'll go for it. We'll see what
Yeah.
happens.
we need to talk to our legislators.
Yeah.
Yes, you do. All right. Item L, fund balance commitments. So every June, the board passes a resolution which says at the close of the audit, the business manager and or superintendent has to adjust the fund balance commitments. We had a total audited fund balance of $30.8 million. Of that, we had 12.5 million in district-wide building and repairs. That's your 5-year capital plan amount. So that's committed. Healthcare stabilization, we kept the same at 1.5. Upper box, we kept the same at $500,000. Peter's retirement spike, I had to shrink because you can't have negative unassigned fund balance.
Oh.
And because the assigned fund balance or the amount of money dedicated to this year's budget on a fund balance, which is $9 million, was a growth over the prior year. That had to come from somewhere. So we took the retirement spike on it. These are your commitments and your assignments as reflected in the audited statements. And now you just have to ratify them.
Any questions? Anyone?
So, for my edification, what's the uncommitted fund balance? at this point?
I think you mean unassigned. $199,000.
Which is certainly less than the 5-7% that we have in our policy.
Yeah.
Not fixing. Yeah, okay.
But I had no choice but to include the district-wide building repairs for the 5-year plan because it's been Palisades' practice to pay cash for those projects. So I had to sort of back into what the unassigned fund balance left was.
I totally agree.
As opposed to getting a bond.
Yeah, as opposed to.
All right, just so everyone.
And that day will come
Right,
because
right.
you can't.
Yeah, these funds,
You
once
can't
they're
keep,
gone, they're gone.
you
Right.
can't keep paying cash for capital projects
Right.
forever.
Right.
That day
So,
will come that we'll have to get a bond issue.
but so just to let everyone aware, right?
Well,
As
wait,
we
so
brought-
why is that? But I mean, why if we were being very fiscally prudent, couldn't we budget to save money in anticipation of those major capital?
So
That's basically what we did.
that's basically what you did. But as we look further in the financial reports, the prior month expenditure to date summary, you can see that expenses are running hotter than prior fiscal years. We're getting pressure in areas like maintenance and operations where inflation is running hot. And, you just may not have, this year does not look like it's going to be a year that we're going to add to fund balance.
Right, but so I just wanted to make sure that I was clear. So there's not some legality that we are not allowed to continue to do what we've done in the past. We're talking about realities.
Correct.
So I would just say, I'm not as quick to say, oh, not gonna happen, you're gonna have to do, I would rather go from the perspective of what can I do to be fiscally responsible to continue to make sure that I'm putting money away. Because I think we do that on our households. I think we do that with any business, okay, that wants to be viable. Okay, they are saying, hey, I'm gonna need a new roof in 10 or 15 years or whatever it is. And they're saying, okay, that roof is gonna cost approximately this much. They're dividing that by 15 if it's a 15-year. And that's how much money they're putting away in savings so that when that 15-year roof project comes up, they're not going, oh, I gotta go out and borrow this entire amount of money. So I'm just saying, I would like to try to keep that, in mind of trying to do that.
But we're probably headed in a trajectory that the era of 1% tax increases is over.
Well, once again, we're here to have to make the tough decisions, not the
Yes.
popular ones all the time. So,
And that's very true, and that's a discussion for another time. I absolutely agree with having an emergency fund of sorts, but that's where this is the formula I've been asking for. What are we as a district comfortable with it, seeing that we try to keep that number at, but not continually increasing that number, Scott? Because as a district, what we're asking the people to pay, I think, should be going out to pay for the things that we need. So we're not here to create a savings account of sorts within reason. So there's a fine line with all of that, but I feel like I just think we should have a formula for that, what we want that number to try to stay at.
so I would just say there's a difference between an emergency fund and a capital projects fund. So that's all, because an emergency fund is never gonna, never gonna account for that roof or that major boiler or whatever it is. And if we all of a sudden were floating all of these bonds and paying all this interest out, we would be looking in a much different position financially. So we're a lot better off, okay, having these small incremental increases in taxes that in reality don't hurt that substantially as compared to going, oops, we got to float these bonds. Now we've got interest payments on top of this. Plus we still have things that are getting old and need to be replaced and so forth. And that, do I have to point to our national, deficit? Okay.
No.
So, and I've been very proud, and I'm not saying I don't take any credit for this because me coming on this board, previous boards, Jim, you can take all the credit. Okay, set things up so that we had this, so that when the tech school did their major renovation, we wrote a check Penridge and Quakertown had to float bonds. You know, so the savings that we have brought to the taxpayers of this district over all of these years of not having to take bonds and pay interest. Interest is just money on top of the money that you spent. These are the things that need to be highlighted when somebody goes, oh, but look at what you have in savings. Yes, our sewage treatment plant, I was going to say it in a much more crude way, but I tried to say, okay, you know, took a, you know what, all right, we're not having to go out and do bonds in order to replace that, because previous boards were fiscally responsible and were able to write that check. So I just don't want to lose sight of that mindset.
Right.
Because I'm not going to be on this board when, okay, if we lose sight of that mindset. But I am very thankful for previous boards that were smart, and I would like to leave that same legacy, you know, for my kids and previous boards.
Any other questions?
Just a general statement. That has been the board policy for quite some time. That being said, the use of fund balance to basically create that balance, but or buffer, we need to keep that in mind. I mean, we've used fund balance to balance our budget for quite a while, and it's worked.
Well, and in most cases, we didn't need to dig into it. Correct. So, which is that, like that, that's the part I think needs to be, because if you just stop at that sentence, people don't understand. Oh, so every year you've dug into fund balance in order to balance the budget.
Well,
Yes,
really.
we have on paper,
And that's these folks that have done
but then through our administration and through a very fiscally responsive board, we've made sure that the monies were allocated if they were needed. But then as the year went on, we've been able to not use all of those dollars. And in some cases, revenues were higher than what was anticipated. And that's what allowed us to also put some of that extra money away into fund balance without having these huge increases and without putting out for bond and paying all that interest. So.
Thank you,
Good. Okay, item M, Colleen, do you want to take this one?
Sure. Rob Riley, the engineering teacher, one of his friends, Keith Blair, had donated a 3D printer, worth about $300, and we're just asking for your acceptance of that donation.
That seemed foolish to say no.
Yeah.
Yeah, that's good there, right? Yes, all in favor, aye, aye.
Item N is, a procedural matter. We had a name change on the signature card at the bank. We have to file the paperwork. They want to see that that's done through the minutes of a meeting. So hence you have a resolution. Or a motion is what we call it, but yeah. Then we have our financial reports, January budget transfers. There are none. Prior month expenditures. We're at 49.1% of the budget, which is the highest rate since 2021. Charter school update, we are at the same level of children as we were in December. Right to know requests, nothing really jumps out at me there for January. Economic update, revenues at the state level are higher than they were a year ago. I think that's just a little.
I have one short topic. First, the federal government has reviewed and redesigned the nutritional requirements for the lunch program. We are now allowed to provide full milk for students and staff. I'm in favor of doing that, but
while the federal government's passed it, it hasn't come down to us yet as state regulation.
it has just this last week. And the breakfast regulations have not passed legislation yet, so they will come. So
we will follow suit also. We're forgiving each other.
Public comment. Sorry.
Okay.
Does that mean you're gonna be nicer to your cows?
What do you mean? I have to put cows on again? You know, there was a time that we got the milk locally. They got the concrete, got milk from Almer's.
Oh,
Really? Yeah.
good old Peter and Homer.
Do we have any other questions for the committee here? Nope. Any other last minute things going around the room? No? Brenda? Scott? Jim? Gentlemen of the jury at the end? Thank you very much, everybody, for your time.
Thanks.
Enjoy your donuts.